Greetings. Welcome to the Pandemic Podcast and me, Dan Astin-Gregory. Semi-breaking news. The news is out. It would have been even more breaking if I hadn't been in a meeting when it was made. Plan B in England is a goner. The tide is indeed turning, it may seem. No sooner than I recorded this week's prior episode asking the question, is the tide turning, then today the Prime Minister making announcements about the current COVID restrictions. So let's see what the Prime Minister had to say about the restrictions earlier today.
We can return to Plan A in England and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end. Can, of course, choose to use the NHS COVID pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. Mr. Speaker, Mr. Speaker, from tomorrow we will no longer require face masks in classrooms, and the Department for Education will shortly remove national guidance on their use in communal areas. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people and no longer criminalise anyone who chooses not to wear one. The government will also ease restrictions further on visits to care homes, and my right honourable friend, the Secretary of State for Health and Social Care, will set out plans in the coming days. Mr. Speaker, as we return to Plan A, the House will know that some measures still remain, including those on self-isolation.
Thank you to GB News for the footage there. So there we have it. The Prime Minister announcing the changes in England. Plan B is a goner. Great news all round in terms of the removal of these restrictions. Great to hear that the masks in schools will be removed as of tomorrow. So to summarise, the COVID pass, aka vaccine passports, domestic vaccine passports are gone for now, at least in terms of the government's use of these passports. Private institutions are still obviously next in line to do that. The mandatory masks are gone for the public. Mask wearing in schools and working from home. The last piece really around the kind of main restrictions is the visitation rules for care homes, which I'm sure will alter in due course. Now, there are, of course, based upon that announcement, several important areas to continue to work on. Most importantly, the vaccine mandates within the NHS and within the care home sector. I'll talk more about that in a moment. As well as travel restrictions. Of course, we've got still issues with travel around Europe and the rest of the world, and the vaccine passports on an international level pose a real challenge to freedom of movement. So the reality is this is great progress for England. This is really strong progress. Now, those of you in Skeptic Corner with me on this one, or Common Sense Corner, we'll notice the cheering in the house. You know, this sudden turn. I mean, we are literally nearly 3 weeks out from Christmas, where, if you remember, we had all of the hysteria about Omicron, the new variant, which seemed to be strategically planned, really, to drive the vaccinations through the roof. Despite the early evidence that was very clear, you almost had people from South Africa pleading with the rest of the world to say, "Hang on a minute, chill out, you lot. This seems to be milder." But no, we had to go for the hysteria phase. So, but good news, here we are. Nonetheless, we are here. Great to see these restrictions ending in England. Now, this is positive for a number of reasons, because you'd be surprised. I mean, Britain does it does feel like it's the center of the universe. People, but unfortunately, Britain doesn't have that magnitude of weight in the world. But it does, in seriousness, play. It does seem to have an effect on other parts of Europe when Britain makes decisions in this way, or at least it has far. So I think this is a important move here, taking the lead, and hopefully it will have a knock-on effect. Although we'll be doing an episode on this on Monday next week, actually taking an international view on the situation. There's still a lot of craziness, hysteria, and insanity around Omicron in different parts of the world. So I'll give you an update on that on Monday. But Britain has had a knock-on effect in other areas, and maybe this is a promising sign for the rest of Europe as we transition out of this. The sceptical side here is that Boris obviously has come under fire in recent weeks, and it has been quite apparent in the social media sphere, at least, that the public sentiment has dramatically changed. People are getting on with their lives, and there's been a lot of public outrage around the restrictions. There certainly was around the talk over Christmas of a potential. There was this looming moment where it looked like the sage advisors, in all their hysteria and false modelling, would get their way with the lockdown. I even did a whole episode talking about what that would look like based upon the insights that were coming out of Sage. But that created a real pushback amongst the much wider segment of society, having many of us that have been campaigning throughout this, nonetheless, were joined by a lot more people, which is what led me to this conversation about how the tide is turning, because it was quite evident there was a lot more resistance now to any restrictions. So perhaps this is Boris now playing to the popular vote, because the great news is in terms of the recorded cases, they're dropping significantly. That there was a sharp peak and a rapid fall back. Now, of course, if you look at the testing data, you can see that there's also a reflection in the testing. But some of the other measures around healthcare and mortality are they haven't dropped at the same rate as the cases. So this isn't the government choosing to follow the science. When I say the science, I'm talking about Sage's fear mongering and overinflated models here. This does feel like a political move. Now, that said, I am very grateful to see this happen. Very, the right thing has happened, but you can't help but think there is, as with all of this throughout the last 2 years, politics is once again playing its role and just pandering to the popular vote. Nonetheless, you can't complain. These things should never have been in place, and they are moving on. Now, what's happening in the rest of the UK? This is a very important question. Wales is still clinging on to a lot of these restrictions, Scotland and other places as well. So this is really important to see for England moving forward, and hopefully have a knock-on effect on the rest of the United Kingdom and Ireland. But the pressure must be kept on, and certainly the core issues of the vaccine mandates. You can't start seeing newspaper headlines around living with the virus and treating it as a common cold, and then fire over 100,000 NHS workers for failing to get vaccinated in the spring. That just simply, you can start to see a real clear disconnect here. And, I think the pressure really now does need to ramp up. We're calling it internally 2 weeks to flatten the mandates. And the reason we're calling it that is because, I say internally, very publicly, we'll be using this terminology very shortly. But you might gather that there's plans to really work hard on these vaccine mandates to make sure they don't go ahead. And we're calling it 2 weeks to flatten the mandates because, according to the timeline, of course, that the government has put together around the end date on this, is that according to that data, you'd need to be having your first jab by the 1st of February or close to that. So we've got around 2 weeks to make sure that we move the needle on that campaign. So this is a really important one. That thinking about, I've heard some really emotional stories of nurses and doctors who consoled people during 2020, holding the hands of the dying who weren't able to see their family. And of course, they weren't vaccinated at the time. None of the NHS workers were vaccinated in 2020 up until December, because there wasn't a vaccine available. Now here we see those very same workers who cared for family members of British citizens during their dying days and throughout dark and desperate times when the public were unable to see their own family members. And now they stand at the verge of losing their job despite working tirelessly throughout the last 2 years to serve the British public. So it's really important that we come together as a nation and stand against these vaccine mandates. The hypocrisy of these approaches is quite frankly unethical, immoral, and just downright wrong. And it's time for us to really push hard. 2 weeks to flatten the mandates, to certainly, at the very minimum, delay the process so that we can put the strongest argument forward to kick these mandates truly into touch. And then, of course, in terms of international travel, we have a situation here with the vaccine passports in place that numbers of people can't travel. The EU is still talking about from March banning the unvaccinated from traveling within the European Union. I just don't see how any of this can hold, given the trajectory that we're witnessing. So again, politics and pandemics don't mix here. There's work to be done, but we mustn't neglect the positives here. That seeing these restrictions removed in England, and the work must continue. There is, of course, a series of worldwide demonstrations this Saturday all around the world, and a number of locations in England and the rest of the UK. These demonstrations are really, really important, that we continue to go to these marches and the protests to keep the pressure on. 2 weeks to flatten the mandates we have here. This is about medical freedom. And again, this is about standing up for the rights of the workers. It's time to protect the NHS. People have been out in their streets banging pots and pans during 2020, clapping for the heroes. Well, where are you now? You must join us now in standing up for those heroes that people were celebrating throughout 2020, and make sure that we stand strong so that 100,000 plus NHS workers who worked so tirelessly throughout the entirety of the pandemic to support people during their darkest times do not suffer the consequences of losing their job through these egregious mandates. So make sure you attend those rallies. If you can't make it to London or wherever you are, have a look at the different locations in the United Kingdom. Of course, these are happening all around the world. So there's work to be done. And of course, international travel, as I mentioned, is something that's really, really important that we've got to start moving forward on. Now, I mentioned this on Monday's broadcast around the tide turning. I do think we do need to be mindful here that I do think things will start to change quite quickly. And I think that's happening on the basis that quite clearly the media and the pushback on what's gone before us over the last couple of years is ramping up. People are starting to awaken to what's gone on. The evidence is becoming in the public domain around some of the major flaws of what's underpinned the policies. I mean, there's just too much to go into on all the different things that all the evidence which invalidates a lot of the suffering that all of us have gone through these restrictions and mandates. So, of course, scrutiny and accountability comes to mind. And of course, the narrative will want to move on swiftly in order to minimize the harm of that. But rest assured, some of us are not willing to let go. And it's time to beyond this next big push. And I do believe we are in this phase now where we just need one big push or one or two big pushes to get rid of these mandates in order that we begin to move into the next phase, which is about public inquiries, international tribunals, and new treaties and legal opportunities to make sure this never happens again. So really important, and I appreciate there are some cases out there taking place, and it's a promising start, but there's a lot more work to do. And to borrow the phrase, or to hijack the phrase, Matt Hancock used to say, "No one is safe until we're all safe." This whole phrase is flawed in many ways, but to borrow the phrase, no one is free until we're all free. No one is free until we're all free. So we have to work hard, not only domestically but internationally, to remove these restrictions and truly begin to move into the next phase of recovery and starting to rebuild a better future. So breaking news today: Plan B is a goner in England. Really pleased to see this. Let's keep the pressure up. 2 weeks to flatten the mandates. One big push. Let's get rid of these final restrictions over the coming weeks and months, and work together to unite the citizens once again and bring back sanity and a sense of humanity so that we can actually start to really bring a positive shift to people's lives in the next months and beyond. So thanks for tuning in. Really appreciate you joining this a special broadcast. 2 weeks to flatten the mandates is what's coming up soon. If you'd like to be part of the campaigns that we're working on, or part of our community that is going to be working on reimagining the future as we move forward, very excited to be launching our private community very soon, the Elevate Network. Please do subscribe to our mailing list if you haven't done so already at danjgregory.com/pandemic, where you'll join our email mailing list, and we'll keep you up to date about our latest interviews and content and our community. And our next interview is coming up tomorrow, talking about the childhood vaccinations with Ros Jones. So looking forward to that one. Please do sign up to the mailing list to get details about some of the issues that have surrounded the childhood vaccination rollout in the UK and the challenges of the trials. It's going to be a really insightful interview. So watch out for that tomorrow evening. Join our mailing list for all the details. And thank you again for tuning in. Great news. Plan B is over and out, as am I. I'll see you on our next broadcast. Good evening to you for now.